And I think maybe there's a slight false dichotomy here in that, in some senses, the health of society has been placed against the economy of the society, and these are not either ors. And I would say this because if, for example, our caution on reducing or adapting public health and social measures, or extreme public health and social measures, also known as lockdowns, if that happens too quickly, the impact will not just be on the epidemic rising again, it will in itself create a second wave of economic problems as you shut down again. And that's what nobody, I think, of all the economists are saying. The worst thing that could happen now for the economy is not an extension of the current lockdown, it's a repeated series of lockdowns done in an uncoordinated way. And that will be more damaging to the economy in the long run than a careful and measured exit strategy that balances the need of the lives and of livelihoods. And it's not to slow anyone down, it's to understand too that there are prerequisites for that happening. And people in business, I think, get this more than any other sector in society. This is about risk management, and there are trade-offs. Lockdowns that are eased where the virus is still present will result in a significant residual risk of the virus re-emerging. So the real question is, have we put in place the risk management architecture for that very likely eventuality? Do we have the public health surveillance architecture to detect those cases early? When we take samples, can we turn the tests around early? Have public health authorities got the contact tracers and the tools they need, electronic and otherwise, to do that work? Is our health system capable of easily absorbing a small increase of cases and not collapsing again? Are our communities fully engaged and fully aware of this longer-term adaptation of behaviour, and are they willing, without enforcement, to continue that behaviour? Because what we want to get away from is lockdowns, enforcement, the idea that society is hemmed in and the economy can't restart. So what you'd like to get rid of is the lockdowns. What you'd like to get rid of is state-based enforcement procedures of people's personal hygiene and social and physical distancing. And the only way you get there is to put in place a really solid public health infrastructure, a real early warning system. It's almost the fire may start again. We've just had a big fire, and the fire flames have died down. And now we're all going to go back into the forest and everything's going to be fine. No, we need an early warning and reaction system in case that fire starts again. I think it's really important that we, public and private sector, stop looking at health prevention, health protection and healthcare delivery as a cost in our financial growth model. What we've clearly seen is not protecting the health space has led to a massive financial cost. So the question is, how much are we willing to invest? We have spent trillions of dollars protecting against armies that are going to roll over our borders, against terrorists that are going to blow up our buildings, and against all kinds of other existential threats. But we have been effectively defeated by a microscopic organism, and it has brought our global economy to a standstill. The real question is, do we see health and health protection, health preparedness, healthcare resilience, as we now see it, as a cost and a drain and a drag on economic growth? We have to change. We've got the same issues with climate, and I've seen a much more positive engagement from the private sector on issues around climate and sustainability, and I really welcome that. I would really like to try and have that same discussion around health, health prevention, healthy lives as a goal equally as important as managing the negative implications of climate change. We need to come back clean, we need to come back green, we need to come back as a society that cares a little more and is willing sometimes to not follow the mantra absolutely of growth, but the idea of sustainable growth that has communities and societies at its centre. And when we spend what we're spending, trillions of dollars on economic mitigation, and I would argue, and it's very concerning to me personally, that we seem to be balking at the kinds of small investments that we need to make in testing, in building a public health architecture, in training contact tracers, and in fundamentally putting in place an early warning and reaction response mechanism for that, and investing in our community's knowledge, their attitude and their practice, their ability to absorb and internalize information and then act upon that information in a safe way. And this is really the test at the workplace, because the workplace is a microcosm of society, and how workplaces go back to work will not only represent an increased or decreased risk, but actually could represent a model of how society moves forward. The private sector can clearly demonstrate that there is a safe, responsible and risk-managed way to get back to work. And I think that will emanate through society and build confidence for other things like social engagement. So the private sector has a dual responsibility. Yes, get back to work safely, get back to work so we build confidence in our society in general. I think what we have to be happy with is there's a tremendous amount of product development and innovation, and that stands to both the public and private sector collaboration on that. But what I can guarantee you is everyone's working so hard across all the sectors to make that vaccine and make it happen. What I have to say, though, in tempering that expectation, is that we've never built a successful vaccine for a coronavirus. Building and scaling that up in a way that it's accessible to everyone is going to be another challenge. So it's not just making an effective vaccine. So having a vaccine in no way means we can deliver it, and in no way means that people will accept it. So we have a lot of work to do, not just on the vaccine, but on community acceptance, on anti-vaccination, on production scale-up, on transfer of technology, on contract manufacturing, on equitable access. Because unless we protect everyone, we're protecting nobody. My fear is our capacity to leverage a production cycle and a distribution cycle and a preparation cycle that will meet with that vaccine's availability. And that's not a given. And it's going to require a significant investment downstream in countries. We did an analysis recently, and we believe that probably less than 25 countries have the regulatory architecture in place to even approve such a vaccine quickly and in time. So there are real structural issues.